Welcome to NU 501 Advanced Nursing Roles, Seminar 1. I'm Amanda Alexander, and I'll be your presenter. Our agenda tonight is a brief introduction to the course. We're going to discuss weekly schedules, late policies, Turnitin, the seminar schedule, graduate student expectations, Unit 1, Learning Activity and Discussion, the Consensus Model, and we'll review the upcoming assignment for Unit 2. Our textbook is the Advanced Nursing Practice, Exploring Roles and Opportunities for Clinicians, Educators, and Leaders by Carolyn Hart and Peggy L. Bell by Walters Kluwer. Currently, the book is on electronic resource only, so you will need to go through the library to obtain the book, and it is electronic. Our weekly schedule consists of 10 weeks for the course. Each week begins on Wednesday, hence today being our first day of class. It starts at 12 a.m. and it will end on Tuesday the following week at 11:59 p.m. Eastern Standard Time. Please note the course time is Eastern Standard Time, especially those of you that live in the mid or western part of the country. For our discussion post, initial post is due on Saturday by 11:59 with 3 scholarly references, APA formatted. You will need to respond to 2 peers by Tuesday night. The discussion board requirements, let me make sure that I have covered it all, and it looks like it. Okay, late policies. So assignments and project due dates are typically the Tuesday at 11:59 p.m. of that unit. We do have a late submission policy, so you are expected to submit all assignments and projects by the end of the unit, but you may turn in late work up to 2 weeks after the due date. After that, a 0 will be assigned for each assignment. 10% of the assignment value will be deducted after the assignment is graded for each week that the assignment is late. So the first week you'll receive a 10% discount on your grade, and the second week you will receive a 10% off on your grade. So that would equal 20 for 2 weeks, or a 0 any time after that. If the 2-week late period enters into the Unit 10, all eligible late work must be submitted by the Sunday of the last unit. No late work will be accepted after this without incomplete grade approval. I will determine whether an exception to the Purdue Global Late Policy is appropriate. Note, I may also require you to provide documentation for the reason if I determine that an extension is warranted. I will provide you with the expectations of your submission and assignment in writing. If you have any extenuating circumstances, but are not limited to, so what would include and not limited to family or personal issues, hospitalizations, family deaths, severe weather events, natural disasters, military deployment, are all things that I can work with. Internet connectivity at times may be spotty or a problem, especially in areas where there's a lot of storms. Computer-related issues, work-related activities, account blocks are generally not considered extenuating circumstances. Turnitin. We use Turnitin for the courses to prevent plagiarism. So some of the assignments you will need to put it through the Turnitin to submit it, and you do not need to do anything other than that. It's already set up for you. All you have to do is submit it to the Dropbox, and Turnitin will automatically enable the scoring for you. If it is not turned in through Turnitin, I will not grade it. Okay, our seminars. So tonight, this would start the beginning of the week on a Wednesday. Each week, we will have a seminar on Tuesday. So from now on, when the upcoming Tuesday comes, that we will have a 1-hour seminar for discussion around the content. You have an option to attend when the seminar is offered or listening at a later time. The seminars will take place at the specific time posted. If the seminar is graded, the seminars are all graded, sorry. Your attendance in the seminar is graded by whether you were at the seminar and I have you on, signed in on Zoom, or if you turn in the alternative assignment that you can do. So if you're not able to make a seminar or not able to come engage with the class, then please do the alternative. The alternative assignment is basically listening to the recording and writing a paper for full credit of attendance. Academic support services, there is a link underneath academic tools. So if you look at the top of your Canvas page and look for academic tools in the drop down box, there is a link there for you to do some review of that has a lot of great things in it. The resources on writing for an APA, I did include the link to this PowerPoint, so you can just click the PowerPoint and it'll take you to the writing and APA resources. Another recommendation I have is mybib.com. So mybib.com. It is a resource page or a tool that you can use to help you with formatting your references in the correct APA format. Plagiarism. So for this content, you will be doing quite a bit of writing. It is expected that you write with your own words. So if there's copying and pasting of other people's words or thoughts or ideas, or if you copy and paste from AI even, that could be considered plagiarism. We want to know that you have knowledge of the content. We don't want regurgitation of other facts. So please make sure that you are discussing the content in its capacity with your own words and not utilizing other people's information. The Writing Center is available for you, and there are also writing seminars and webinars that are available if you need help in those areas. Student expectations. Be aware of your time constraints. This can be very busy to do, so work hours, holidays, vacation time, and other demands, family demands, can be all consuming. To enter classes for a higher degree, it will take some determination and some extra time from you. So try to allot yourself at least a few hours a week to get your work done. However, you need to manage that, but be sure that you are definitely communicating with me if you are having issues with getting something in. Also, exercise high professional standards in all of your aspects of research and in readings and doing the conversations during the seminars. We want to be respectful of each other and of each other's works. Seek additional resources through the university if you need them. So, Introduction to Advanced Nursing Roles. So we're going to talk about Chapter 1. The learning objectives for Chapter 1 are to examine factors affecting advanced practice roles, identify a need for lifelong learning among nurses, compare 3 professional roles, so the educator, the administrator, and the clinician, what their comparisons and differences are, and what their required advanced education is. We're going to analyze components of the American Association of Colleges of Nursing, essentials, and contrast differences between the different program types for competencies. When you come to seminar on Tuesday, I would like you to be able to answer questions pertaining to these areas. Factors affecting advanced practice roles. These little questions to ask yourself is a really good way to get started in understanding what your needs are for this program. When we consider factors that have pushed advanced practice roles, one of them is the implementation of the Affordable Care Act. Its intent was to decrease rates of structural inequities. The purpose was to provide access to insurance, expand Medicaid coverage to include low-income adults, and to support alternative care delivery models. With that being said, it drove a need for more nurse practitioners. The physicians became overwhelmed and are still overwhelmed. So there is a drive for more advanced practice nurses in our fields. The 3 degree options nursing degree options that are available to us are, of course, RN, BSN, MSN, DNP, and PhD. BSN nurses are considered the generalist nurse. They have a broad, wide scope of practice and knowledge, but it's at the base of what a nurse will know often. MSN nurses represent the profession by their field of study. So for instance, they typically are advanced practice registered nurses, clinical nurse leaders, clinical nurse specialists, master's degree nurses with education, informatics, and administrative degrees. Doctoral prepared nurses, they're nurses with a terminal degree. They have studied in previous fields of study and may have different terminal degrees. This typically too for a DNP is the entry level for a CRNA. The DNP does focus on scholarly works that improve healthcare systems and patient outcomes. They look at knowledge that is existing or research that is existing and implement it into practice. PhD practitioners are also terminal degrees in research and education, although they create new nursing knowledge. Advances in healthcare and research technology require all to engage in continuous learning through academic courses, staff development, and professional development events and courses. Nursing is a lifelong event. You're going to continuously grow because everything is continuously changing, often changing. So we're often finding ourselves back in school, taking more professional development courses, being mandated professional development courses. It's a consistent practice for us as nurses. The educational system, the pathways, are regulated by governing bodies, and they are associated with monitoring qualities of nursing practice. Several are named in this chapter, so make sure you read the chapter. One specific is the IOM, so Institute of Medicine, who published To Err is Human. The lengthy report proved that the healthcare system needed guidance. We needed mandated objectives for proficiency. Now, other agencies have taken up that thought process and are contributing to nursing and what our focus is. One of the things that was interesting in the readings was research conducted by the IOM in 2010 noted that due to the increasing need of advanced providers, we fundamentally need to ensure educational pathways for our new nurses, and the goal was more, to double admissions into schools and graduates due to our needs, and we were able to increase BS nurses by about 5%, and we doubled the masters and DNP nurse population. So that was a pretty good outcome for some of the goals that were set. Nursing leadership roles, when we're considering a nursing leadership role, it's crucial to healthy work environments and financial wellness of the organization. So we will get more in depth with nursing leadership roles further into the book. But for now, know that they constitute management, administration a lot of times, but also our staff nurses. I consider a nursing leader someone who helps grow others. So that can be any one of us. Finally, clinical providers are now outnumbering physicians who are expected to cover them. So this creates a looming deficit in primary care, and we're looking at the research is saying about 55,000 providers needed by 2032. So categories and examples of career choices. This is an overview, advanced practice roles. So some of the commonalities for each role are leadership. Everyone in one of these roles are considered leaders in their practice. Nurses with advanced educations are prepared to lead teams. They do conflict resolution, influence policy, and create organizational change. And often you're going to see that many of them have an entrepreneurial spirit. Educators range from clinical positions to graduate school. They have competencies directed by the NLN. Administrators, the NLN is the National League of Nursing too. The administrators are leadership management roles in healthcare and academic settings. Their standards of practice are guided by the AONL, so their competencies come from that organization. Clinicians are APRNs or CRNPs, and they're considered generalist roles that manage acute and chronic illness. The CRNA is a nurse anesthetist or nurse anesthesia. They often work in surgical centers, therapeutic offices, diagnostics, and even obstetrics. Nurse midwives, they primarily provide women's health care. Clinical nurse specialists. Clinical nurse specialists are experts in areas such as pediatrics, geriatrics, ER, oncology, and neurology. And then we have our clinical nurse leaders. They function as part of the team to disseminate communications plans and assess risk of care. Education licensure considerations. So learning objectives for Chapter 2 are the purpose of nursing accreditation, to review degree and postgraduate certificate options, compare what the PhD and DNP options in doctoral education are and what they do, discuss licensure and certification requirements. You're going to also read about standards for the APRN terminology as presented in the consensus model. Education and licensure considerations, Unit 1, Chapter 2. Okay. Accreditation is a process by which educational institutions and programs, so it can be a hospital program also, or any program of study, they undergo evaluations for standards of practice often set forth by accrediting agencies such as the NLN, the CNE, CCNE, ACEN. The purpose is to protect your interest as a consumer and the interest of the public who will be receiving care from you. Achieving accreditation demonstrates to the public and the institution efforts towards quality in practice. So it shows them that you have achieved a standard that is higher than what is expected. When considering the degree options, it is important to evaluate the potential for movement. When I say movement, that means, can I work in Florida and work in Georgia? Does my licensure allow for me to move from one area to another? That is something that you may want to consider when we're thinking licensure. The DNP versus PhD option. So the DNP, when we're thinking about degree options, the DNP is a terminal degree for an advanced practice nurse, and so is the PhD. The PhD, though, creates new research or, comes up with new ideas for research, and the DNP utilizes research that is already available and implements it in practice. Advanced practice nurses who graduate or seeking graduate degrees can attend schools of postgraduate certificates. So after you graduate with your nurse practitioner and family practice, you can go and get a certificate as a psych mental health nurse if you decide to. Even I, as an educator, can go and get a certificate in a different area now that I have already received my master's in my degree area. The nurse practitioner can also attend institutions who offer these certifications other than their original certification. So that they can attend schools for just the certification itself. It doesn't have to be a whole new program to enter because they've already received the nurse practitioner certs. For the NP, CRNA, and others, it does require a certification before application. So if you are trying to get licensure at the graduate level, you will need to make sure that your current licensure is up to date and without any penalty. Okay, the APRN consensus model. So this is directed by the NCSBN, and the goals of the consensus model are to strive for harmony and common understanding for the nurse practitioner regulatory community that would continue, like promotion of education, the standards of practice, the development of vision for APRN regulations. This includes education and accreditation and certification and licensure also. The consensus model also is a set of standards that protect public and improve mobility again. So it also improves access to safe, quality care for the patient and produces written documentation that reflects the regulatory standards and issues for the nurse practitioner. So Unit 1, the review of the assignment here. There's an introduction. It's approximately 100 words or so. Introduce yourself, okay? This says to conduct a brief interview, virtual or in person, with a nurse practitioner, nurse educator, or nurse leader. Your submission should include a summary of 500 words of the interview focusing on individuals' role development, challenges, and influence of profession. A comparison of the interviewees' insights with key points from chapters 1 and 2, and then proper APA citation and formatting. Unit 2 assignment, we're going to analyze the difference between advanced nursing practice, advanced practice registered nurses. Evaluate the population served within your advanced nursing practice role. Create a LACE, so licensure, accreditation, certificate, education plan for your chosen role. So say, for instance, you're taking these courses for your family nurse practitioner license or certification. We want to know about that. So use LACE to describe what that's going to look like. Examine state-specific regulations or implications for that role that you're pursuing, and then provide examples of interprofessional collaboration among advanced practice disciplines. Your first paper will come in Unit 2, and you'll submit a single Microsoft Word document 4 to 5 pages in length, excluding the title and reference page. Use proper APA 7th edition formatting, including the title page, reference page, and in-text citations. Consult the Academic Success Center for support if you need it, and then refer to the grading rubric in the course resources for evaluation and criteria. I do recommend that you look at every one of the grading rubrics because that is how I grade. I will go by that standard, and if there are points missed on the grading rubric, that could cause you to lose points in your grade. So making sure that you follow that and hit those bullets on there, and you will be good to go. Okay. And finally, remember to post general questions in the virtual office area. So there was a couple questions already starting out. So just to make some clarity, this week Unit 1 starts on Wednesday. So Wednesday of the quarter start day. The final day for Unit 1 will be Tuesday at 11:59, so that will be the end of that Unit 1 week. So I guess from Wednesday to Tuesday. For the Week 1 or Unit 1 criteria, we will have a seminar on Tuesday for discussion of the contents that you should have read and work completed. Now, to consider assignments, make sure you go in and review the directions for the assignments and follow the directions that are provided for you. And again, follow the rubric and you will be good to go there. Okay. The other questions that came about were being at seminar. So if you are unavailable to attend seminar, you will just complete the alternative assignment, which is reviewing the lecture and writing a paper in response to what you learned from the lecture and submitting it in the seminar Dropbox. You can also email me if you have any questions or text me, and I will try to get back to you as quickly as possible. I look forward to seeing you Tuesday. Thank you for listening to this Unit 1 seminar. Have a great week.